Dr. J has been in practice for more than 30 years. This includes acupuncture, herbs, massage, homeopathy, nutrition, communication, weight loss, addiction treatments, NRCT, to be later explained, specialty treatment of panic attacks, and others. With respect to paperwork and pedigrees, Dr. J has a bachelor's degree in Japanese and sociology, a master's in acupuncture, and a doctorate in Oriental medicine. Dr. J has been getting educated and diplomaed in acupuncture and Oriental medicine since 1978. He's licensed in acupuncture in California since 1983, in acupuncture nationally since 1985, and in Indiana since 2003. He's a certified naturopath from 2 certification boards, and was licensed as a naturopath in Washington, D.C. for more than 15 years. Dr. J's educational background also includes specialty expertise in workers' compensation in California, with the very rare status of being an acupuncture QME, Qualified Medical Evaluator, with the California Industrial Medical Council. As a diplomate of the National Board of Acupuncture Orthopedics, a certified disability evaluator, and having certification in first-line therapy for obesity, as well as being licensed as a NRCT, Neurologic Relief Center Technique Practitioner. His genetics include an uncle who was a surgeon and his grandfather who was a chiropractor. And his specialty training and for valuable use today is in hugging. Dr. J.
Dr. J. Sordian practices at the Redwood Clinic in Berkeley. He has been a member of EBAR for about 3 years and has been a licensed acupuncturist for about 30 years. He has 2, not 3 daughters, both aged multiples of 3, 12 and 8 respectively. Today he has decided to divide up his talk into 3 sections: his background, the 3 primary causes of disease and illness, and third, the 3 types of referrals he's looking for. Dr. J loves the colors maroon and turquoise, and his favorite number is, can you guess?
43. 8. 42.
No, it's 7. All right. Let's now enjoy an informative journey and take the natural path to optimal health with Dr. J.
Thank you. So Chinese medicine has a concept called the 5 elements, and there are 5 seasons that we talk about. Right now we are in winter. Winter is associated with the bladder and the kidneys. And so these particular organs are associated with the adrenal glands, the back, things having to do with what's inside bones, like the bone marrow, spinal cord, and the brain. So I'm going to talk a bit about the 3 primary causes of health problems and conditions. All 3 also can be related to the adrenal function. So the first one is, what's that word?
Stress.
Stress. Exactly. The second one is what's that word?
Trauma.
Trauma.
That's
Exactly.
good.
Very good. Now, and the third one is, hopefully you can see this over the table. Third one is toxicity. So the primary symptoms of stress, read along with me here. Headaches, anxiety, tiredness, brain fog, allergies, insomnia, digestive disorders, and pain of any sort. That's right. So, do you know anyone who's suffering from these? Raise your hand. Sorry to hear that. And so the question is, where is the stress coming from that is causing any of these? Well, figuring out that puzzle of stress is something that requires careful listening, looking at and examining all aspects of a person's life, and unique systems to evaluate how the stress is affecting feelings, and then to decide exactly what the causes are. So finding the pieces of the puzzle allows me to create a plan and an effective program to address the causes. Addressing the causes actually might involve having to treat the adrenal glands or other hormones in the body. I might have to address the brain and how it's working, might have to affect the heart, how the subconscious mind is operating, and also affecting and correcting energy flows in the body. Now, I've studied the subject of stress since 1965. I know you don't think I'm that old, but I also published an article on stress in 1985 when I first moved here to California. Many patients say that the treatments are the reason why their panic attacks and their overwhelming feelings of anxiety have been totally eliminated. So I've worked with many people with these issues. Now, I also hear that people say that they have stress affecting them every day. Would anyone here say maybe stress is involved in your daily schedule? Well, people who come in for treatment often feel a decrease in their stress responses after their acupuncture treatments. Now, partly that's from the mood elevating effects that my treatments produce. Now, part of this is endorphins, which are the natural pain-killing opiates our brain produces. Another reason is because the active listening I do while they're in the office. And part of it is also balancing hormones that result in the brain having a relaxation response. So the second item, do you remember what the second item was? Trauma. So trauma includes various things. It could be physical, mental, emotional, spiritual, and energetic. So I see a wide variety of people who come in with traumas. They could be athletes, maybe professional athletes, teenagers, adults. I see weekend warriors, injured workers, people in car accidents, and adults who come in with years of carrying the burden of childhood abuse. They all feel comfortable talking to me so we can actually get down to discovering what's going on underneath, because oftentimes this is buried and people really don't talk about some of these really old emotional traumas easily. So it could be physical things like headaches or back pain, or difficulties breaking through barriers at work due to communication issues. So oftentimes I will help people communicate more effectively at work based on the evaluations that I do. So I have to listen to and explore their trauma history. I examine them properly for documentation. For example, if it's a car accident or work injury, we have to document it properly for insurance purposes. I palpate the area of the injury, unless it's like emotional and deep in the heart. I don't stick my hand all the way in their heart. But I'm also there to support people physically, emotionally, and spiritually. Of course, in traumas, I also refer people out to appropriate other professionals. It could be a psychotherapist, it could be chiropractors for adjustments, it could be surgeons, and it can be for imaging studies like MRIs and CT scans. The third item that is a primary cause of health problems is toxicity. Toxins either are developed within the body. Our body does naturally produce certain toxins that it has to eliminate on its own, but there's also toxins from outside, which there's more than 100,000 new artificial and man-made chemicals that damage the body. It can damage the digestive system, cause fatigue, cause memory problems, and a lot of other things. Usually a normal, healthy diet, even organically, is not sufficient to address the damaging effects of these toxins. So understanding the influence of these toxins is another part of the puzzle that I have to figure out in order to help someone achieve their optimal functioning. And I'm quite good at doing this. I do screening for heavy metals and for chemical toxicity in almost every patient that I see. And this is quite unique to my practice. You will not find your physicians typically doing this kind of study. I use screenings that are fairly inexpensive to start out with, to take care of people's finances, so I'm not a strain on their finances, but to figure out whether we really need to do active work as far as heavy metal toxicity or other chemicals. And it's interesting to note that toxicity is one of the causes, underlying causes of obesity. So my target audience, three different ones, keeping with the theme of 3 today, is people who have 15 pounds or more that they need to lose. I am doing a talk next Tuesday at a gym called Strong Island Fitness. It's called The 5 Secrets to Permanent Weight Loss. I will be focusing on toxicity and how to deal with that. So that would be one target individual. If you know of someone who could lose some weight or has toxicity issues, please refer them to this talk. We are charging $20 for the talk. My second target market is women 25 to 55 years old who may have hormone problems. They may have what? Anxiety and panic attacks. This, what's this? Read that. Headaches, or infertility, or fatigue, and brain fog. So this again fits in with this theme of winter and the adrenal glands and how it influences the entire body. And the third area that is also associated with winter, the bladder and the kidneys, is back pain, or it could be anywhere on the spine, related to injuries or the daily grind of life. So people love coming out of my treatments feeling really great and more invigorating, but they also often, after being uncomfortable for a long time, they come out and see more hope in the future for themselves and people in their family. And people really love, I hear this often, that someone comes in, they say, you know, I wasn't so sure if things were changing, but somebody else said, wow, you look so much younger, you look so much healthier, so much happier. So oftentimes it's outside people can see the change occurring more quickly than we ourselves can. So I am devoted to helping people figure out the puzzle of exactly what's causing their health problems, and then working together with them to help them regain their natural healing power, which is essentially what I'm doing, trying to remove the obstacles to healing, and also do this through my unique and comprehensive approaches. Thank you for coming here today, taking time out of your busy schedule. You could be elsewhere, and you aren't, so I want to thank you and acknowledge you all for being here and being such great members of our BNI group. Thank you. Brain fog. Brain fog is a situation where you're trying to remember things and it's not clear, or you're walking around and it's just like things are a haze. Usually you're more sharp, you can think of things more quickly, and it's just not working well. Thank you.
Dr. J, how do you test for metal toxicities?
So for heavy metals, we do a urine test. It's a heavy metal urine test that screens for heavy metals coming out of the urine, because it shouldn't be coming out of the urine. It should actually be coming out of the stool after it's been chelated in the cells and then dragged out through the liver, out through the gallbladder, into the intestine, and then pooped out. So that's a quick screen, but it's quite effective in getting an initial idea of what's going on.